The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. And indeed it is. We're coming at you live from the Scottsdale Money Radio Studios right here in the Scottsdale Air Park. 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. And how do we do this? We bring great guests to the show. And I am going to just cut right to it. I got two really great guests here in the studio. I'd like to introduce them right now. So Linda Buscemi and Scarlett Springs, both with TapRoot Interventions and Solutions. Welcome to Health Futures.
Thank you, Bob. Good to be here.
Thanks for having us.
It's good to have you guys here. And you guys are in a startup mode.
Yes.
And you guys are healthcare professionals. And before we jump into what you're doing, I would love for our listeners to know a little bit about my guests here today. So Linda, why don't I start with you?
I will. Well, I'm technically a psychologist. That's my background, about over 20 years. I've been in the area in Arizona for that long, doing some provider work, working for a managed care health plan. So I kind of have all the different components there. In the last probably over a decade, been really focusing on the dementia, Alzheimer's space. And so it's been fun, and we'll get a little bit more into how we are going to automate what we've been doing. I've been doing for a consultant aspect for the last 10 years.
And I met you when you were working with a managed care organization.
Correct.
So
yes.
you've got some great background. Are you originally from here?
I'm not. I'm actually from Michigan.
Michigan.
Mm-hmm.
All right. Did you go to Michigan?
Oh, no, but I wish I did. I love the Wolverines.
Go blue, right?
Go blue, exactly.
Unless you're a Buckeye. No,
don't
that
even
doesn't.
talk about
or
that.
Spartan.
Yeah. No. Rival.
Well, we'll jump into TapRoot in a second.
Sounds good.
But Scarlett, can you share with us about your background?
Absolutely. So my background, I grew up in corporate America in big pharma. So I was with Merck, AstraZeneca, 19-year career history, launching some drugs that our audience may be familiar with. Prilosec, Nexium, Crestor, and then I had the opportunity to run the oncology division, and we launched a drug for non-small cell lung cancer called Iressa, and the hormonal franchise, so drugs for breast cancer as well as for prostate cancer. So after 20 years of doing that kind of work, I ended up coming back to the Valley, and I worked a couple of years for GPEC, the Greater Phoenix Economic Council, which was absolutely delightful. And then I got bitten by the startup, the early stage. I ran a medical device company that was looking for a diagnostic for early lung cancer, and now pivoting, and Linda and I are the co-founders of TapRoot Interventions and Solutions.
Fantastic. So I'm sure there's a story about how the two of you met, because you guys are, your paths crossed. I'm curious to how they did.
Well, interestingly enough, it crossed at a Cardinals football game. Go Cardinals!
Mm-hmm.
Nice.
We love being undefeated this year, but
there you
yeah,
go.
that was kind of that was the genesis.
Yeah. Yep.
Fantastic. And this concept that we're going to jump into, I get the feeling that the brainchild is right there right in front of me, and that's Linda. Linda Buscemi, you're the one that came up with this idea, and obviously you've partnered with Scarlett to bring it to fruition. Tell us what it is and what it's all about.
Yeah, I couldn't do it without Scarlett for sure. So, like I was mentioning, being in this space for so long, you start to see patterns, right? My background's psychology, so there's patterns in human behavior. And so helping folks with keeping people at the lowest level of care, you notice that when someone has people in the audience may consider it's a behavior, dementia-related behaviors. I like calling them reactions because I believe that someone is reacting to a situation. It's based on how we're approaching that person that may inadvertently escalate that reaction. So over the time, been noticing that if we kind of figure out what the reaction is, maybe they're exit seeking, maybe they're refusing to change clothes, whatever it might be, you ask a series of questions to understand how to then best approach to prevent or reduce that particular reaction. So that's what I've been doing. We've been doing it manually for years. There's a few of us, of course, in the Valley that do exactly what I do. They're fantastic at it. We're trying to, we have automated that aspect of it.
And it's really with the caregiver in mind. So TapRoot is about elevating the caregiver. And we're doing that by bringing Ella. That is our platform technology that is about supporting individuals with cognitive loss. And we're about improving care.
Ella is the SaaS.
That is correct.
Which is a software as a service. I think that's as they call it in the tech
That's
world.
correct.
And this is really, when you talk about helping with behaviors and our space, the older adult space, the behaviors that we run into are, obviously mild cognitive issues that are happening. We also run into dementia and Alzheimer's. And Ella is something that can be used for all of them, right?
That's correct.
Absolutely. Yeah, I mean, one of the questions that we always ask is what type of cognitive impairment do they have? Because there's different kinds. There's many different kinds of dementia, which people think that dementia and Alzheimer's are synonymous, and they're not. Alzheimer's is a form of dementia. And you have your Lewy bodies. You can go on with the different kind of cognitive impairments, and those are all important to understand because they're different. And it also means that their reactions of that particular individual are going to be different, and therefore the intervention and approach would be different. So we take all of that into consideration to provide the best approach to keep that individual as calm and as happy as possible.
Right.
And with that caregiver, particularly if someone is in a care community, in a given day, they may actually see someone with absolute mild cognitive impairment and at the same time see someone who is unable to articulate what that unmet need is. So we're really trying to support that caregiver, whether it's their first day on work, at work, or whether it's their 15th year at work, and the various scenarios that might get presented in any given day. How do you quickly assist them in being able to meet that unmet need of that particular person with cognitive loss?
I love it. I mean, I'm just going to cut right to the chase. I love it because we at Cypress, we employ caregivers. We utilize the Honor Care Network, which I've shared with our listeners before, with our partners in Honor. And our goal is always to give caregivers tools to be able to be successful in caring for the people that they care for. And this here is a huge tool that caregivers can have in their tool belt to be able to help with whatever behaviors they run into.
Exactly.
We're getting ready to finish our first segment here, but I want to talk about, when we come back, Ella, and obviously the AI that runs Ella, because there's so many different forms. And you said that best, Linda. I mean, they say there's like 80 or 90 forms of dementia.
Yes.
I mean, 75% of them are Alzheimer's,
Right.
but they're Lewy bodies and others. And then there's various signs of mild cognitive impairment. And we don't know what we're dealing with, but I would imagine the brainchild of Ella, she knows.
She knows.
She knows. Well, there's a great tease for the second segment. You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Linda Buscemi here in the studio. I've got Scarlett Spring. They are with TapRoot Interventions, and their SaaS that they have, their app, is run by Ella. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, Here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second segment here, and I am pleased to have in the studio Linda Buscemi, and I've got Scarlett Spring. They're with TapRoot Interventions and Solutions, and they have this app that is run by Ella, and I teed off the segment here that we're going to talk about with the various dementias and Alzheimer's that are out there. We're talking about at least 70 to 80 different dementias and various cognitive impairments that are out there. Ella seems to be a great solution for that. And I want to just share with our listeners that, it's Cypress Home Care and home care agencies like Cypress, we train our caregivers. Mm-hmm. And at Cypress, we, for the last 6 years, have been specialized in dementia. And the hardest thing that we go through is, one, finding a caregiver that has experience, and if doesn't have experience, wants to learn about how to work with people that are cognitively impaired as well as have a dementia. And then two, want to be able to teach them that. And we spend hours. I mean, each one of our caregivers goes through 40 to 50 hours of training. And in home care, the biggest challenge we have is turnover. Mm-hmm. And,
yes.
And if I have a client that is receiving care from multiple caregivers that have this skill set, if I can't deliver another client when that client has either gone to be placed in a memory care unit or has passed and service has ended, that caregiver goes somewhere else, and that's an asset that we lose as a agency. So I, Bob Roth, am very intrigued by what you are creating here.
And we are very supportive of training. Training and culture is so important, but we do recognize that there is a caregiver scarcity that is out there, and being able to have an on-demand tool for that caregiver, not only to be able to help de-escalate a particular event, but importantly to also push some training vignettes. We love didactic training, we totally get that. But as adults, when you can get a training nugget that is about what's happening in your particular scenario, your particular shift, when that training is coming up, it has so much more impact, because you can actually do something about it right there and implement what you've learned. And that's the way that we're trying to have this application, not only be able to provide solutions, but also continue to educate, once again, whether that caregiver is day one or, day, 1,500, right? It's like whatever the situation of the caregiver, we want to be able to give them the solution.
And personalizing that solution. I think that, to Scarlett's point, there's some, and I know many of the people in the space, they're fantastic trainers out there. The programs are phenomenal. They have the virtual now that is just so enlightening to the being empathetic to the situation of someone that has these particular cognitive losses. But when you only do that once or twice a year, perhaps, hopefully, to your point, you 40 hours in the beginning, what happens the rest of the year? And so, Ella's able to not only impact the training aspect of it, but also personalizing and pinpoint the exact reactions each individual is having, and then how to personalize how to intervene and approach them in that manner.
Could you do a deeper dive in that? Because that's the thing that I think is extraordinary about what you've got is, I think about a caregiver that comes to work for a home care agency who, goes into a client and provides care for them and mm-hmm. really doesn't have a whole lot of history, but maybe there was caregivers in there prior, and that's the part I think that makes Ella very interesting.
And that's because Linda approaches this from a behavioralist perspective. Her psychology background and understanding what is the background of that person and what are those drivers has been really pivotal in that.
Yeah, and we collect a lot of information to be able to help tailor it. So it's not just the favorites, and there's a lot of great intake forms out there that communities use and providers use, and we do want to know what their favorite snack is and their favorite hobbies and things like that. Fantastic. But there's also more information that we need to know about that person, or it would be helpful to know about that person to then specifically personalize that intervention. Because you can Google how to take the car keys away from mom or dad. I mean,
Right.
that's that's what I'm saying. There's a ton of information out there, but how to actually extract that information and then apply it is not easy to do necessarily. And you're talking about caregivers going in and out and don't even necessarily know. Maybe they have the education, maybe they don't, because we just talked about the scarcity of it. This is where Ella's going to really help someone, as Scarlett said, day one.
Love that. Absolutely love that. And Ella, obviously has a lot of information in there, not just about that specific client, but has like a resource library, right?
Right.
And that resource library, I would imagine, is very deep.
It is. So we have, we call it our education center basically, and we have a lot of different training vignettes. We call them vignettes because we want to make sure that they're easy and can be listened to or watched within a shift or on a lunch break. So they're anywhere from 30 seconds to no more than 10 minutes, and we purposely do that for that reason. So they can quickly see, gosh, I'm having a really hard time with Mrs. Jones, and this is what's going on. Maybe I can quickly watch this on my lunch break or as I'm walking, to the bathroom, right? They're 2 seconds long or 2 minutes long. So we make sure that we do that purposefully to be able to provide that training in between the big programs and the trainings that you do offer, that folks do offer. We're in between is like the way I like to put it.
Love it. So we're going to be coming up on halftime really soon, and my question to you guys is, you guys are a startup,
Yes.
and you guys have been at this for how long?
So we actually founded the company. We launched our first MVP right before COVID. It was in February of 20, and
MVP?
our minimum viable product.
Okay.
So
Yeah,
sorry about that.
that's all
Yeah,
right.
but we wanted to get something in the hands of caregivers and then start interviewing. So we were fortunate enough to be able to work with a couple of different care communities, both assisted living as well as some nursing home communities, and put a first mobile application in their hands. It was clunky early on,
Sure.
but that way we could begin to talk to them about what works, because the last thing that we want to do is to have a cumbersome tool. We also recognize that caregivers are very busy, and therefore we didn't want them to have to be constantly looking at this app. So how do we make sure that it worked into their flow and that it was easy to use? So fast forward to early 2021, we did a soft launch January of 2021, and then really got out into, we're in 5 different units, both here in the state of Arizona, whether that be in Tucson, as well as is here in the Phoenix Metroplex area. And those that data that we've been receiving from those clients has been instrumental, particularly not only as a startup, but important for us to continue to learn, because the one thing we want to do is to stay very in tune to what our customers are asking. And so making sure, do we understand what's happening with the executive director, with the director of nursing, with that caregiver? Because we've added some features to Ella beyond what Linda was talking about of just the particular interventions or solutions and trainings. We've also added some additional features to that so that there is some benefit for everyone, the caregiver as well as the caregiving team.
Love that. Absolutely love that. And you guys have been really busy. And I know that when you're in startup mode, you have to evolve. And obviously, like you said, the word they use in the Silicon Valley is pivot, but I like the word evolve better. You've evolved from where you started in February 2020 to where you're at now. You said you had 4 or 5 communities you're working with, and one of them I happen to know is a national chain.
Yep.
So, I mean, that gives you some validation. I mean, let's face it, that's what we're looking for, right, is validation. We want to validate the hypothesis that we have that Ella is a solutions-oriented SaaS for caregivers. And you've been able to demonstrate that, which is really exciting.
That's right.
It really, really is exciting.
It is.
And-
As a startup, we're very engaged in the startup community, whether it be Startup AZ, whether it be the Arizona Commerce Authority, and the virtual accelerators, as well as the Innovation Challenge that the Commerce Authority is putting on now. So we're very connected into that group, which, continues to keep you disciplined around where's your fundraising and what you're doing, as far as making sure that you're continuing to be very customer focused. And that's at the heart of what we're trying to do, is solve problems and have overall improved care.
So you have been able to demonstrate this, obviously, to the families, and these communities are loving what they're seeing. Any prospects for doing it in home? Because that's the space I'm in. And I wish, I have a partnership with Honor, so I can't pilot it, but are you talking to anybody? And if you're not, I'd love to be able to help you do that.
We will. So right now we're in the care communities, but this is a tool that absolutely could be used at home. It's not consumer based just yet. We still need for that to be what we'll call a professional caregiver. So whether it's in a facility or employed by a home caregiver, but that's exactly long term where we would like to go.
Love it.
Yeah, that's the idea. I mean, we want to keep people, and this is probably in industry speak, but the lowest level of care, right? It's best for the family. It's best for the individual. It's best for the family. Financially, it's more responsible, and it's just the best way to care for someone. And we know Ella will help with that.
Yeah, I believe so too. I really do. And certainly I can't wait till you get into that home setting. At Cypress, we had a dementia program where we were able to, we've demonstrated through our work and validated that we can keep families together 7 to 8 months longer.
Wow.
By being together because of the dementia training.
That's amazing.
And one of the things, hopefully, that we'll get into in the next segment is that very topic around family members, because we do have a feature there that we'd love to tell you about.
Well, we're at halftime here at Health Future. Stick around. TapRoot Interventions in the second half. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, we're in our second half here. If you missed our first half, go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show, and you can catch this show and about 400 others we've been bringing to you for the last 8 years. So if you're just tuning in, I have TapRoot Interventions and Solutions here in the studio with me. I got Linda Buscemi and I've got Scarlett Spring, and we are talking about this SaaS that they have that's called Ella. And Ella really helps caregivers with people that are dealing with behavior issues. More importantly, the behavior issues that we're really concerned about on our show is with older adults, and that's mild cognitive impairments as well as dementia. And along with dementia is Alzheimer's. So I really want to pick up on what we were talking about, and I think, Scarlett, you were talking about in the second half, is, caregivers. And a lot of times it's family members that are caregivers, but, you wanted to, or we talked about family member updates and stuff like that.
That's right. So Ella is elevating the caregiver, but one of the things that we recognize is in that care team, there's a family member. And one of the things that after some interviews is we thought about, how do you create a dialogue, a communication between a frontline caregiver and that family member, and yet still doing it, recognizing that caregiver is busy, they don't have time. And so we really came up with a unique solution that doesn't require an enormous amount of time for the caregiver to be able to answer a few menu-driven questions that are very much about what's going on with their loved one. And it will send an email to that family member that gives them an update. And it's an update like you would want to know. Is my loved one being hydrated? Is my loved one having meals? Are they being able to engage with others socially? So it's the activities of daily living that would give them that sort of quick snapshot to what's happening in their loved one. And after we ran a pilot this past year, 100% of the family members said they wanted to continue to receive that kind of an update. And then very powerfully, 92% said a community that had that kind of communication, 92% of them said it would make a difference in where they placed their loved one. So very powerful that family members really are driving this transparency into long-term care communities, assisted living communities, and that's what we are trying to foster as well.
You know, I love that communication. That's what we do with Cypress and Honor, is that we have a portal as well as we have emails, regularly getting information to those family members, those loved ones, so they know what's going on. I mean, they feel that guilt not being there, right? And they want to know, is mom okay? Is dad okay? You know, is he safe? And really to be able to let them know, not only is he okay, these are the things that we're doing.
And we saw that a lot during COVID, and this is when we actually launched the pilot on this, and it was so powerful. Because given the situation, what's been happening, folks couldn't go in, and even with the lack of caregivers, that was also something, is how do you communicate our providers, meaning that you have prescribers going in, whether it's a primary care doctor or a psychiatric practitioner going in to the community. They were actually asking, hey, we saw this family member update, can we also receive that? So of course we asked and had to make sure the family said okay. They love that because they're able to see, again, Ella is a caregiver tool. The caregivers are the front line. They're the ones caring for the individual. We need to talk to them and get the information from them so we can better care for the person. And so that was actually really powerful. The provider actually wanted to receive that update as well.
Love that.
Yeah.
And Bob, you've kind of referenced a couple of times about this being a SaaS tool and how important that the analytics and the machine learning is. If you think about urinary tract infections, which tend to be something that happens pretty routinely.
It's common.
In those facilities. If you're really looking at hydration, you know, on the one end, and of course, if an individual is refusing showers, you can have an early warning system that could push to that caregiver that you need to make sure that Mr. Jones in this particular shift is drinking fluids, and or that you are showering Mr. Jones, because you're almost a ticking time bomb of when that urinary tract infection could be coming. So what we're trying to do is make sure that this analytical tool is once again pushing some notifications about the health outcomes, about what we know about urinary tract infections, and how do we make sure that we're at least having some early warning around the things that we know are prone to aggravate or cause urinary tract infections.
I mean, our goal is to prevent health events, right?
That's it.
I mean, that's what we want to do. I mean, it's not just a heart attack or a fall. It's, you know, events like having a UTI. And I think you all know, maybe our listeners don't know, but, you know, Scarlett, you and Linda understand that UTIs can really sometimes be perceived to be a dementia or a mild cognitive impairment or even delirium. And if we test for it and we know that they have a UTI, all we have to do is get them on an antibiotic and they get back to being themselves.
Right. Many times when you do see some behaviors that you're not noticeably seeing, many people will say it's dementia right away, and many times it's some form of medical condition. UTI is a great example of that, but there are a lot of different kind of medical conditions that may be causing that type of memory impairment. So I always suggest people to make sure you get medically checked out. And not just, you know, go straight towards, you know, this person has Alzheimer's or dementia.
Right. Well, you know, you said this earlier when we first started this segment. You talked about elevating the caregiver. That's what Ella does. How'd you come up with the name Ella? Was it over that, or?
It was. I mean,
because I loved how you said that.
Yeah, right on. We knew we wanted a frontline caregiver tool. And not only did we look at elevating the caregiver and kind of that being the go-to name, but we also really wanted a name that had an element of warmth to it. And Ella is something that makes you think of your favorite aunt or your favorite grandmother.
Right,
so
right.
it just kind of worked that Ella fit for what we were trying to do, and that is just it. We are elevating that frontline caregiver and providing them tools.
I love that. Absolutely love that. So I want to give to our listeners a way to find out more about TapRoot interventions. So first and foremost, taprootinterventions.com is the website.
Mm-hmm.
And if you want to call 602-574-2177. And I know that we have a lot of people who are healthcare professionals that are listening to our show. You've got 4 or 5 pilots in place right now, but those are listening in that may be involved in a community setting. These ladies are interested in doing more pilots, right?
Absolutely. That's really our focus going into the first of the year. Of course, we are right now and adding some of the technology features between now and the end of the year. But being able to grow and get Ella into more communities is our entire focus for 2022.
Love it. So we're going to come up on a break here. I want to talk about in the 4th segment, I want to talk about what are some of your milestones that you're anticipating and hoping for in 2022. And I also want to find out what your long-term vision is for Ella.
Right.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Linda Buscemi and Scarlett Spring here in the studio. They are with TapRoot Interventions and Solutions. We got one more segment. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. If you're just tuning in, we're in our 4th segment. I've got TapRoot Interventions and Solutions here in the studio. I got Linda Buscemi and Scarlett Spring. And if you missed the first 3 segments, go out to our website at cypresshomecare.com. Click on the media button, 3rd button down is radio show. You'll catch this show and many more. So we're talking TapRoot, we're talking about Ella, and we're talking about interventions. And want to pick up on that because we had a little bit of conversation during the break talking about evidence-based, right? And that's kind of the term that we use in healthcare. Evidence-based is how we demonstrate the success of a pharmaceutical drug or an intervention like Ella. So I would like you to talk a little bit, if you would, Linda, about some of the interventions that you and evidence-based stuff that you've got.
Yeah, and as we talk throughout the show, when we use those words interventions, that's exactly what Bob's talking about is that evidence-based. And so these are non-pharmaceutical approaches. And many times, unfortunately, we see our community with people with mild to severe cognitive loss. We use psychiatric medications to help manage their symptoms. And sometimes it's appropriate. We are not against medication at all, but let's just use it appropriately. And so what we've been able to ascertain from our early data showed that we had a 13% reduction in psychiatric medications that was needed to be prescribed because we were able to use these evidence-based non-pharmaceutical interventions.
That's big.
It's huge.
And not to knock the medications, but we all know these medications metabolize in all of our organs and can have side effects and other issues that come along with those.
Right, and it's a high percentage. Now, I don't want to say 100%, but it's a high percentage of these type of medications have black box warnings, contraindications for dementia for this population. So that's not good either. And they're sedative. So now we're looking at an increase of potential fall risks because we're trying to help manage the individual and because of their behaviors, right, the reactions, when if we just had a better way of approaching them, these evidence-based non-pharmaceutical interventions, we could avoid the medication or at least decrease the medication.
Love it. Love that. So I teed up this segment, and I wanted to really talk about some of the milestones that you're looking to achieve in this coming year. And then I'd love to hear about some of the long-range plans you have for Ella.
Absolutely. So some of the milestones that we're looking at is just number one, we want to make sure that we're really focusing on that frontline caregiver and how are we creating some efficiencies for them and really being able to prove that out. That's first and foremost. Secondly, for the community, can we demonstrate that they can actually manage some of these unmet needs and these escalation vents, because sometimes that's a real cause for hospitalizations. And if the caregiver was just aware of how to approach that individual in a much more personalized way to be able to de-escalate that behavior, then that individual staying in that care community is good for everyone. It's good for the resident, it's good for the family member, and it certainly is good for the home. So those are a couple of important ones. Linda mentioned a few just earlier around we always just want to be mindful of the meds that the individual is on, because they do have concomitant disorders at that time. Many patients have some hypertension, and then you'll see some of the sedative drugs on top of that. But as we go into into next year, that's kind of what we're looking at is enrolling communities so that we can prove out those data points. And then on the business side, we're certainly in a space of where Linda and I, as co-founders, we have bootstrapped this because we feel so strongly about the organization, and we are now getting into a space of where we need to grow. And we're now at a point of where we're out for our first offering. Of course, it's not a solicitation, but it's nice to be at that phase of the business because it really is about growth, and that is a lot of fun.
Well, and I think also you've been able to prove the concept because
Yes.
you wouldn't be at this phase. I
That's
mean,
right.
you started it. You've got 4 or 5 communities that are on board. You've demonstrated some of the values that you've been looking at to achieve your hypothesis, and you've achieved that. And there's nothing wrong with that. I mean, now you need to get to that next phase. So, if you are listening to this show and this is appealing to you, especially the senior space and being able to provide non-pharmaceutical interventions to be able to keep a loved one safe and keep them calm and minimize behaviors, TapRoot Interventions. TapRootInterventions.com or call 602-574-2177. So long-term vision. Ella, I mean, what do you see? Do you see Ella being like Alexa? Do you see Ella being like Siri?
Yeah, I mean, you're spot on. I mean, you're so knowledgeable in this space, so you totally get it. What we believe is that number one, we are in care communities because we are training the rest of the machine learning and the SaaS, but there is such an unmet medical need for family members that are at home. And so our long-term goal is we certainly believe that the database that we are curating, the database that we're putting together is going to be a part of a bigger solution that will be coupled and will actually help that consumer that's at home, that at-home caregiver, and certainly paired up with the technologies that you're talking about so that it will be voice activated.
Voice activated, and you foresee an app that you could
Yes.
download.
Absolutely.
And have, I mean, I want our listeners to visualize this. I mean, have a lot of data because data is the key. I mean, you talk about AI, machine learning, you put enough data into a funnel. Humans are very hard to predict, but if you got enough data in that funnel, you can get pretty close to predicting some outcomes and being able to mitigate an escalation or an issue for a family member or even a paid caregiver, correct?
That's exactly right.
There's a lot of questions that we ask, and that's kind of the secret sauce here. It's not just asking a handful of questions and saying, boom, there's the approach that you should have. There's a lot that goes into this and a lot of different areas that you need to understand about that individual, the different diagnoses that they have, their different background information, the historic aspect of their medical conditions. All of that matters and means something to how we then approach that person. And this is where our algorithms are so smart that they're going to be able to look at this profile of a person and immediately, based on the different diagnoses and the background, be able to produce a personalized intervention.
See, TapRoot, we believe that if we can tap into the long-term memory, then we increase the probability of being able to have this intervention to de-escalate and mitigate that particular scenario or that particular event. And so that's where TapRoot came from, is tapping into that long-term memory to try and support the care for that particular individual.
Love what you ladies are doing. We got about a minute left. Is there any questions I haven't asked that you would like me to ask or talk about? Or is there any lasting impression you want to leave our listeners as we wind down?
Well, really, it is about, TapRoot is about the caregiver. And Ella is elevating that caregiver, and we've wrapped solutions that are good for the long-term care community, that is good for the rest of the care team, and importantly, we've wrapped in that family member. So that's what we're about, and we are excited.
Love it.
Yep, excited to take this next step in 2022.
Love that.
Yep.
So just to shift gears, you talked about it right at the very beginning, Cardinals.
Yes.
We got a big game on Sunday.
Yes, we do.
All right, go 6, right? 6
Yes.
in a row.
6-0, fantastic. We got the Brownies. Also, I want to leave for our listeners, today is the first day of open enrollment for Medicare. So that window is not open very long.
Yeah.
So make sure if you are Medicare eligible or for the very first time, you need to probably talk to some professionals to get as much information as you can to make an informed decision. Also, tomorrow is the first memory walk here in Arizona. We have one out in the West Valley. So if you're interested in the memory walk, it is over at the Glendale Heroes Regional Park. If you want to learn more, go to alz.org and you can learn more about that. Linda?
Yes.
Thank you.
Thank you.
Thank you. And Scarlett, always great to see you. You guys bring such great energy, and you guys are really on to a great problem solve that all of us need relative to the behaviors for our elderly and ways to be able to de-escalate and calm situations.
Yep, it was a pleasure. Thank you.
Thanks for having us, Bob. We appreciate it.
You got it. Make it a great day. Have a great weekend. We'll be back next Friday. Take care.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3.